My name is Emma. I am in my fourth year of medical school and will be graduating in May. I discovered I had HAE. I had these series of swells that were around my eyes, and they started in my early 20s. We just weren't sure why they were happening, and I had seen another provider and started talking to her about my swells, and then she eventually referred me to an allergy immunologist. So then he ran that series of tests, and it came back consistent with HAE type 2, and so that's how I discovered I had it. I was feeling really anxious a lot of the times because it was so unpredictable, especially during times of stress when I was in my clinical rotations. It would just flare often. It would be every 2 weeks or so, sometimes back-to-back days, and then it would go a period of time where I wouldn't have swells. And so it was just so incredibly unpredictable, and it was really anxiety-provoking for me. When I received my diagnosis, I was in between seeing patients of my own. I was on my family medicine rotation, and I had gotten this notification. I had gotten an email from my portal. And so I logged on just to check, and I had gotten this really long message from my provider talking about I had HAE. And so to have all of that put in a portal was really frustrating and also very overwhelming, and also receive it, in the middle of your workday without even so much as a phone call. And so to me, I couldn't imagine delivering that kind of news to my patients via a portal. It just set off a whole chain of attacks for me for weeks before I was eventually on a more stable dose of medication. I think understanding your disease, first for yourself, is really important. I was lucky enough to have just a fundamental understanding of what HAE was, but I admittedly didn't even know everything. And so I think being your own advocate is really important. One of my most burdensome attacks was when was on my internal medicine rotation, and at the end of the rotation they're called OSCEs, but they're simulated patient experiences that you have, and it's a really big part of the curriculum and just necessary to be able to understand these simulated interactions and be able to get the diagnosis and fulfill that requirement for the course. And I woke up on the day of, and I knew that I could feel that I would already have a swell. And so I just had felt it. And so I went to the bathroom, I saw, and I knew that I had to treat right away, which I did. But the swelling doesn't just go away very quickly. And so I knew that I would still have to go to that exam with this swelling. And when I have swells, it does obstruct my vision at times when the swelling gets so severe and I let it go on. Oftentimes when I have attacks, it's when I'm sleeping. So I don't know that I have the swelling until I wake up. And so if I don't stop it fast enough, you just have it, and it's just not gonna go away very quickly. So I still had to go to this exam with my eye the way it was. And of course you try to hide a little bit. You try to wear glasses, you try to do other things just to make it not as noticeable, but it definitely is. And so it was very challenging and something that I will remember. It's something also that I just hope that I don't have to do again. At that time, I was doing a prophylactic sub-Q and then a on-demand sub-Q. It's not very fast-acting, unfortunately, and you don't often see the effects or it just doesn't have great efficacy, in my opinion. It just takes a long time to work, and again, it doesn't really necessarily take away the swelling that's already present. So when I wake up or the swelling just develops, it is definitely a race to give myself the on-demand medication. And especially when you have the on-demand IV medication, it's not administered very quickly. It takes some time to set up and to give to yourself, and you have to be in a spot where you can do that, which is at home most of the time. And while I do have the on-demand sub-Q, which is faster to give, it takes longer to work and to see the effects. But again, you just have those barriers of being able to be home to do it, traveling with it, setting it up, giving it to yourself, which is challenging. But there's always just a feeling of dread of just waiting, how quickly is it going to progress in the time that it takes to work? Because it's not an immediate medication. It takes time. And for me, it takes usually 30 minutes to an hour. And so in that time, I could still have progression of my disease. And so it's a waiting game as well. So that anxiety is always there, that dread is always there. I think I'm definitely still figuring my own personal triggers out. I know that different hormones will trigger my attacks, so we have to be careful with Especially when I was doing things such as IVF, we had to take special considerations into the estrogen that I was exposed to. Other things that can trigger my attack are really intense exercise. Those are typically associated with my laryngeal attacks. And obviously stress. Stress is one of the big ones. To administer where you're able to do it, it's a lot. To me, I think one of the things that isn't talked about enough is the mental toll that it takes on a person. You just have so much anxiety all the time with these unpredictable swells that may or may not be controlled by the medication that you're on. Not knowing when they're coming, where they're going to present, how severe they're going to be. It's a lot in terms of changing your life, and you don't want to alter all the things that you want to do in your career that you have and the life that you're living just because you have this diagnosis. This diagnosis doesn't necessarily have to alter all of the things that you hope to do, that we are just as capable of living normal day-to-day lives and not only just surviving, but also thriving in our roles. It's really important.